How long have you been here?
3 years now.
3 years?
Yeah.
3 years right in this room?
Yeah.
Ghana, like most of West Africa, is facing a real mental health crisis. The gap between the enormous need and services is filled by traditional healers and prophets and other spiritual advisors. Oftentimes, this treatment comes with a host of human rights violations.
Mommy, don't leave me. Oh, mommy. Mommy.
We see people who have behaviors that are just difficult to contain, chained to trees or to concrete slabs in prayer camps for days, weeks, months, and even years at a time, forced confinement, forced fasting. Even the traditional healers who engage in these practices are extremely interested in alternative solutions. They're not doing it as a punitive action. In West Africa, there may be a gap in terms of access to mental health training and mental health resources, but there's certainly not a gap when it comes to the penetration of mobile devices. My area of research is mobile health in the study, assessment, treatment, and prevention of mental illness. Adopting the models that we used in the United States, I can easily imagine developing tools that are patient-facing, texting interventions or smartphone apps that provide resources that are easy to understand using simple language or video, stigma-busting content, and practical skills to manage distress. Things that might support the providers, individuals who go out into the field and who might not have the training and expertise to manage complex mental health conditions. We're moving less and less from written interventions into audio and video-based interventions, and those are accessible to everyone. Keep in mind, half of the people that we showed this to, half of the traditional healers, were illiterate. When we talked to them about trying to leverage their personal mobile devices as an instrument to get some sort of support that would allow them not to engage in these practices, across the board, they were remarkably open and interested in this. We've really seen an enormous amount of enthusiasm for the type of mobile health for mental health work that we do. The types of tools that we've developed in the United States can't just be taken and plopped down in the region. There needs to be contextual influence. We need to understand the appropriate languages, the behaviors. Ghana is the ideal setting for this first foray into this world. I think that the will is there. I think the capacities in terms of the technology is there. We just need to do it.